So we are here in Orlando with Dr. Graves. She is leading a healthcare coalition called the Coalition Against Kickbacks to try to get the kickbacks out of the healthcare industry and try to bring down costs. Dr. Graves, thank you so much for being with us.
Oh, you're welcome. Thank you for having me.
So tell us a little bit about how you guys want to bring down healthcare costs.
What we're trying to do is get rid of what we call the middlemen. And the middlemen are those that actually drive up our healthcare drug cost and medication cost. And in doing so, the American people are paying much more for their medications than they certainly should be. An example that we use is insulin, because we have quite a few patients that have insulin needs, and there's about, maybe 48 million diabetics in the United States, and insulin should cost between $70 and $100 a vial. And that's just one vial for 1 month. However, nowadays it costs $400 to $500 per vial per month, and $300 to $400 of that goes to the middlemen. They do nothing for the industry other than just putting it on the market or a tier level. And we're trying to cut out the middlemen. We're working with President Trump right now and his administration, and we're giving them information on how to cut out these middlemen. It's a $200 billion racket, and it's actually kickbacks. They call them rebates, but actually they're kickbacks that they get. And they take that money, and unfortunately, you may not want to hear this, but they take a lot of that money, millions of it, and they put into legislation, and they put into legislators' pockets for re-election in their campaign coffers.
So is that how this kind of crazy system got started, with the kickbacks going into the lobbying campaigns?
Absolutely. In 1987, that was brought to Congress, actually by the Democratic Party. And then the Republican Party, some of those also liked the idea of having contributions given to them by these middlemen. And so they did pass that. And it is a form of racketeering that would normally be totally unlawful if it were not for Congress giving this an exception.
Wow. And so what does an average person out there who maybe doesn't have any expertise in healthcare or the legislative process, how can somebody get involved in this to help out?
Well, you can go to a website called Physicians for Reform. And on there, we have a 4-minute video. And that video explains what the middlemen are. And I urge everyone to contact their congressmen and their senators, because as we know, in 2020, this is going to be a tremendous issue for the campaigns as they come out. We are trying to stop socialism. Actually, it was Lenin who said that socialized medicine is the arch of socialism and communism, and that's what holds it together. And therefore, we are fighting not only for drug pricing, but we're trying to fight to save this country from actually socialism by these middlemen, by socialism coming in. We want that to be stopped, and we want it to be stopped immediately, because if they get socialized medicine, that is the door for us to lose our republic, to lose this country, and to be introduced to socialism and communism throughout America.
Wow. So thank you very much for what you're doing. Is there anything else that I didn't ask about that you want to add?
There's so many things that I don't think we have that much tape.
Okay.
But we'll do it another time. How's that?
Wonderful. Dr. Graves, thank you so much.
I appreciate your time. Thank you.